Along the edges of the eyelids are different kinds of glands, such as the meibomian gland, the lacrimal gland, gland of Cruz, gland of Zeiss. Each of these glands, especially the meibomian gland, has an important role they play in vision. The oily meibomian gland is responsible for reduction of evaporation of tears in the eye, which subsequently keep the eyes moist and healthy. Unfortunately, the duct of these glands can get blocked either by dead skin cells or oil buildups in the eye, which can result in inflammation of the affected gland as well as breeding of bacterial infection, mostly Staphylococcus aureus in the eye. When this happens, it leads to development of bumps in the eye. These bumps are usually of two major types, the stye and chalazion. A stye, or what you people call a boy, is a painful reddish tender bump that is seen along the edges of the eyelid. If it's seen on the inner part of the eyelid, it is known as internal hordeolum. If it's seen on the outer part of the eyelid, it is known as external hordeolum. A stye is usually due to inflammation or blockage of the oily meibomian gland or the Zeiss gland, which is commonly associated with symptoms like gritty sensation, pain, tearing, redness, swollen eyelid, and photophobia. When this happens, the best way to manage this kind of condition is practicing warm water compress. Warm water compress simply means you're getting a clean towel with warm water, then use it to damp the affected eye, which helps to relieve these symptoms mentioned. You can do this at least 3 times a day for swift relief. Because I said it is associated with bacterial infection, it is very important that one incorporates an antibiotic eye drop which will help to combat the bacterial infection. Such antibiotic eye drops that one can use include gentamicin or chloramphenicol eye drop. While you are doing it, it is better to avoid popping the pores. This is because popping the pores can lead to spreading of bacterial infection in the eye, which can subsequently lead to development of more bumps around the affected eye. The other type of bump usually seen in the eye is known as chalazion. Unlike a stye, a chalazion is a hard, painless bump that is seen usually an inch away from the eyelid, caused by blockage of the meibomian gland. Chalazion do not show any symptom but can lead to cosmetic disfigurement. Chalazion do not form a pus, which means that this is not a condition that you can treat or manage at home by yourself. When you suddenly see a bump that is hard and painless some inch away from the eyelid, it is very important that you consult your doctor. It is the doctor that will remove the cyst through a process known as curettage, where a doctor makes a minor incision or cut to remove this cyst because it does not form a pus.